Hi everyone, Happy New Year and welcome back. And if you're new here, I'm Dr. Bazgha Khalid. I'm an internal medicine and obesity medicine specialist. Today, let's talk about a topic that's often overlooked but incredibly important for your overall health, especially if you are on weight loss journey. Fatty liver disease. Your liver is a superhero organ. It detoxifies your body, helps digest your food, and stores energy. But sometimes this hero gets overwhelmed, literally filling up with fat. And here's the kicker, it often does it silently without you even knowing until it becomes a significant health problem. In this video, I'll pull back the curtain on fatty liver disease and explain what exactly is fatty liver, those mouthful terms like MASLD and MASH, how common is it, and who's really at risk, the crucial tests to check for it, and most importantly, the 8 warning signs you absolutely cannot afford to ignore. Stick around to the end because I'll also share some myths versus facts, what questions to ask your doctor, and a sneak peek into my next video on treatment options. Let's start by understanding what is fatty liver and what is fatty liver disease. Simply put, it's when too much fat builds up in your liver cells. A little bit of fat is normal, but when it becomes more than 5% of your liver's weight, that's when it becomes a problem. Think of your liver as a sponge. When it's healthy, it's clean and efficient. But with fatty liver, it's like the sponge is now getting clogged with grease, making it harder and harder to do its job. Now, there are two main types. One is alcoholic fatty liver disease. This is caused by heavy alcohol consumption. Second is metabolic dysfunction associated steatotic liver disease or MASLD. This was previously known as non-alcoholic fatty liver disease or NAFLD. This was recently renamed to MASLD to better highlight that it is caused by metabolic issues like obesity or diabetes. This is the one that I'm focusing on today, and it is the most common type. MASLD, or let's simply call it fatty liver, is not caused by alcohol but by other factors like lifestyle, excess weight, or diabetes. MASLD, or let's call it fatty liver disease for simplicity, isn't just one thing. It's a spectrum. At one end, you have a simple fatty liver where fat buildup is around 5 to 30%, but little to no inflammation or liver cell damage. But if left unchecked, MASLD can progress to something more serious called metabolic associated steatohepatitis or MASH. This is where things generally get concerning. MASH means you have not only fat but also inflammation and liver cell damage, which can lead to scarring, also known as fibrosis. And if that fibrosis gets severe enough, it can turn into cirrhosis, which is permanent, irreversible liver damage and may even cause liver cancer. This is why paying attention to fatty liver is so vital. So, how common is fatty liver and who's at risk? You might be thinking this sounds serious, but how common is it really? Well, prepare to be surprised. Fatty liver disease, particularly MASLD or simply fatty liver, is incredibly common. It is estimated to affect 25 to 30% of the global population, and in some Western countries like USA, that number can climb to 40% or even higher. That's millions of people, many of whom don't even know they have it. Let me ask you, before watching this video, how much did you know about fatty liver disease? Let me know in the comments below. It helps me understand what topics are most important to you. So, who is at risk? While anyone can develop MASLD or fatty liver, certain factors significantly increase chances, and these are obesity or overweight. This is the biggest risk factor. The more excess weight we carry, especially around the belly, the higher the risk. Type 2 diabetes or insulin resistance. People with prediabetes or diabetes often have underlying insulin resistance, which can drive fat into the liver and may cause fatty liver. High cholesterol or high triglycerides, these are often part of a metabolic syndrome that predisposes to fatty liver. High blood pressure. Another component of metabolic syndrome that increases risk for fatty liver is having high blood pressure. Polycystic ovarian syndrome or PCOS. Women with PCOS have a higher risk for fatty liver. Sleep apnea. There's a strong link between sleep apnea and fatty liver. Rapid weight loss. Ironically, losing weight too quickly can sometimes temporarily worsen fatty liver before it gets better. Certain medications like corticosteroids can increase risk for fatty liver. The common culprit here is often metabolic dysfunction. If you have several of these conditions, it's not a question of if you are at risk, but rather when you should get checked. So, how to check or what tests are used? So, how do we actually check for fatty liver disease? Because, as I said, it's often silent. The initial screening often involves number one, blood tests. Your doctor might order routine liver function tests or LFTs like ALT and AST. While elevated liver function tests can suggest a liver problem, they aren't always high, even with significant fatty liver. So, having a high liver function test is a clue, not a definitive diagnosis. And also, normal liver function tests do not rule out fatty liver disease. Number two is imaging. This is where we get a clearer picture. First is ultrasound. This is often the first imaging test. It's non-invasive and can usually detect fat in the liver. However, it is not very sensitive for mild fatty liver and cannot tell us about inflammation or fibrosis in the liver. Second imaging is CT scan or MRI. These are more sensitive than ultrasound and can provide more detail about the amount of fat in the liver. The third imaging modality is called fibroscan. This is specialized ultrasound-based test that measures liver stiffness. Stiffness can indicate fibrosis or scarring. It's a great non-invasive tool to assess if MASLD has progressed to MASH or advanced fibrosis. Number three is liver biopsy. This is considered the gold standard for diagnosing MASH and staging fibrosis. A small piece of the liver tissue is removed and examined under a microscope. It's more invasive, so it's usually reserved for when there is uncertainty or need to confirm the severity of liver disease. Your doctor can combine your risk factors, blood tests, and imaging results to get a complete picture of your liver health. So, what are the 8 warning signs your liver is full of fat? Now, let's get to the critical part. While fatty liver is often silent, your body does try to send signals. If you experience any of these 8 warning signs, especially if you have risk factors, it's crucial to talk to your doctor. Number one, persistent fatigue and weakness. This isn't just I'm tired, this is a deep, unshakable fatigue that does not improve with rest. Your liver works hard, and when it's struggling with fat, it can drain your energy. Think of it like trying to run a race with ankle weights on. Everything takes more effort. Number two, dull ache or discomfort in upper right abdomen. Your liver sits in the upper right side of your belly, just under your ribs. If it becomes inflamed or enlarged, you might feel persistent dull ache or a sensation of fullness or pressure. It's usually not sharp pain, but a nagging discomfort. Number three, unexplained weight gain, especially around the midsection. While fatty liver is often caused by obesity, sometimes the metabolic dysfunction leading to fatty liver can also contribute to stubborn weight gain, particularly visceral fat around your organs. It's a vicious cycle. Number four, dark urine or pale stools. These are more advanced signs, often indicating issue with bile production or flow. Dark urine can be from excess bilirubin, and pale stools suggest a lack of bile. If you see these, seek medical attention immediately. Number five is yellowing of the skin or eyes, called jaundice. Again, this is a serious sign indicating that your liver is really struggling to process bilirubin. Jaundice is a clear red flag that warrants immediate medical evaluation. Number six, swelling in your legs and ankles or edema. As liver damage progresses, it can affect your body's ability to produce albumin, a protein that helps keep fluid in your blood vessels. Low albumin can lead to fluid leaking into tissues, causing swelling, especially in lower legs and ankles. Number 7, itchy skin or pruritus. This isn't just dry skin itchiness, it's a persistent, sometimes severe itching all over your body, often worse at night. It's thought to be due to the bile salts building up under the skin when the liver isn't functioning properly. Number 8, confusion or memory problems, also called hepatic encephalopathy. In very advanced stages, when the liver can no longer filter toxins from your blood, these toxins can build up and affect your brain. This can lead to forgetfulness, confusion, mood changes, and even slurred speech or disorientation. This is a medical emergency. Remember, many of these signs are not specific to fatty liver and can be caused by other conditions. That's why self-diagnosing is never the answer. The goal is to be aware of these potential signs and symptoms so you can have an informed conversation with your doctor. The scientific community has been focusing heavily on fatty liver disease because of its growing prevalence and serious consequences. Clinical studies confirm that MASLD or fatty liver and MASH are significant drivers for chronic liver disease, often progressing to cirrhosis, liver failure, and even liver cancer. They also show a strong link between fatty liver and other metabolic conditions like heart disease, type 2 diabetes, and kidney disease. It's not just a liver problem, it's a systemic health problem. Research is actively exploring new medications to treat fatty liver or MASH, but currently the most effective treatment remains lifestyle modification, especially weight loss. Studies have consistently shown that even a 5 to 10% sustained weight loss can significantly reduce liver fat, inflammation, and fibrosis in many individuals. Let's talk about some do's and don'ts and bust a few myths. Fatty liver do's are: aim for gradual, sustainable weight loss. This is key. Adopt a balanced whole food diet, focus on fruits, vegetables, lean proteins, and healthy fats. Limit refined sugar, sugary drinks, and processed foods. These are major contributors to liver fat. Increase fiber intake. It helps with gut health and blood sugar control. Engage in regular physical activity. Even moderate exercise helps reduce liver fat. Manage existing conditions like diabetes, high cholesterol, and high blood pressure. And the fatty liver don'ts are: don't ignore persistent symptoms. Don't rely on detox supplements. Your liver is your detox organ. Focus on supporting it naturally. Don't make drastic, unsustainable dietary changes. Don't forget to stay hydrated. Don't self medicate. Always consult your doctor. Now, let's bust some myths. Myth is only heavy drinkers get liver disease. Fact is, MASLD is very common and not related to alcohol consumption. Another myth is you'd know if your liver was sick. Fact is, the liver is a silent organ. You often have no symptoms until significant liver damage has occurred. Another myth is fatty liver is just cosmetic like fat anywhere else. Fact is, fat in the liver causes inflammation and damage, which can lead to life-threatening conditions like cirrhosis or even liver cancer. Another myth is if my liver enzymes are normal, my liver is fine. Fact is, not always. Many people with significant fatty liver can have normal liver enzymes or liver function tests. Imaging is often needed for diagnosis when suspicion is high. Let's talk about questions to ask your doctor. Empower yourself with knowledge by asking your doctor these questions. Given my risk factors, should I be screened for fatty liver disease? What do my liver function tests, ALT, AST, mean? Would an abdominal ultrasound or a fibroscan be appropriate for me? What lifestyle changes do you recommend for liver health? Are there any medications that I'm taking that could affect my liver? What are the signs I should be watching for that might indicate my liver condition is worsening? I hope this deep dive was helpful for you. It's a complex topic, but understanding it is the first step towards protecting your liver health. What's one thing you have learned today that surprised you the most? Share it in the comments below. So there you have it, the crucial insight into fatty liver disease and those 8 warning signs you should never ignore. Your liver works tirelessly for you, and it's time we give it the attention it deserves. If you found this video helpful, please give it a thumbs up, subscribe to the channel for more evidence-based health information, and hit that notification bell so you don't miss my upcoming video. Speaking of upcoming videos, I have only just scratched the surface. In my next video, I'm going to dive deep into the most effective treatment options for fatty liver disease and detailed lifestyle strategies that truly work. You won't want to miss it. Until then, stay healthy, stay informed, and I'll see you in the next video. Bye for now.